of actual wound healing that occur. We're going to talk about normal wound healing, and then we'll move into why wounds don't heal in these orderly phases. So the phases of wound healing, if you look in the literature, it's usually broken into these three well-identified phases of wound healing. You have this inflammatory phase, the proliferative phase, and then this maturation or remodeling phase of wound healing. And this timeline here has some, leeway to it, but in general, if a wound is going to progress from initial injury all the way through to closure and maturation, they say that this timeline goes from day 0 of initial wounding all the way up to about 2 years. And these phases fall into that timeline. So this inflammatory phase is usually day 0 of initial wounding, all the way through to about day 5 is when the inflammatory phase of wound healing is happening. The next phase is proliferative phase, is from about day 3 or 4 to about week 2 or 3 of the process. And then the remodeling phase kicks in from about week 2 all the way through to 2 years post-injury. And so there is some overlap between these phases, as you can see on this graph. We're going to go through and talk through these phases, how they actually look, what's happening during each of these phases, and the cells involved. So let's look at the inflammatory phase. So the inflammatory phase, the very first phase of wound healing. So if you think of this surgical site wound here at the top of the screen, or this lower leg wound, this was actually a traumatic wound from one of my patients that had a golf cart that flipped over and fell on his leg. These wounds are both in the inflammatory phase of healing. So what do we see happening during this phase? So initially we have hemostasis. The bleeding has to be stopped somehow. So hemostasis, which occurs through vasoconstriction initially, followed by vasodilation. So the blood vessels tighten up to try to stop the blood flow, and then they relax and they dilate to allow the cells to come in and move through the healing process. We have formation of a clot through platelet aggregation. It helps to clot off those blood vessels and form a clot within that wound base occasionally, and that helps to stop that bleeding. You see these very characteristic signs, these Latin terms that we've seen: rubor, dolor, tumor, and calor, or redness, pain, swelling, and heat that we see in the inflammatory phase. These are normal parts of the inflammatory phase of healing, and you can see some of those even demonstrated in these photos that we see. We see a little bit of that redness on the surrounding skin. We see that taut, shiny skin, which is indicative of some swelling. If we were to ask the patient if it hurts, they might say yes, if they have good sensation, and it might feel warm, which is very frequently confused with signs of infection, of course, right? But in these first 5 days post-injury, this is a normal part of the inflammation phase of wound healing. The primary cells involved in this phase are going to be your platelets, as we mentioned, that help form that clot, the neutrophils, which also are involved with the clotting process, and phagocytosis, which is the ingestion of debris and bacteria to help fight infection and to help create a clean wound environment. Macrophages, which are also involved in phagocytosis, and then the mast cells, which can mediate this entire inflammatory process. This is not an all-inclusive list of all of the cells involved in the inflammatory phase or in the subsequent phases. These are just some of those primary cells that are involved for the essential cells that are needed for these phases. Moving on into the proliferative phase of wound healing. Again, we're thinking about day 3 or 4 if you're talking about normal wound healing, all the way up to about week 2 or 3 of the process. So what's happening in the proliferative phase? We get deposition of type 1 collagen into the wound, which is where we start to see that ingrowth of that healthy red scar tissue, which is called granulation tissue. So granulation tissue is just scar tissue that we can see in the wound itself. So when you think of a scar, we all have scars from some sort of past injury or surgery. Below that was granulation tissue formation, if it was an open wound, that grew to fill in that tissue defect. And it's primarily type 1 collagen that is deposited to grow that healthy tissue. There's also formation of this extracellular matrix. It's a beautifully complex matrix that helps to support the cells that come in for healing, and they promote growth factor deposition. The growth factors are kind of the things that help to keep that process moving along. So platelet-derived growth factor, there's lots of different growth factors that are out there that are deposited that help to stimulate that cellular activity and healing response. The extracellular matrix helps to support those cells and those growth factors. There's angiogenesis, which is new blood vessels that are now starting to grow into that granulation tissue, grow into that scar tissue defect to help fill in that tissue from the inside out. So angiogenesis, that's what gives this tissue this nice healthy red color, is because it's filled with new blood vessels that are growing into that tissue. The primary cells involved in this phase are going to be fibroblasts. They're the ones doing most of the collagen formation in the wound that's depositing that type 1 collagen. And they're also helping to contract that wound together from the edges in towards the middle. Those are called myofibroblasts. Myo meaning muscle. They're helping to pull those wound edges together. The macrophages are involved as mediators of this proliferative phase, and they're involved again with that phagocytosis, or the ingestion of bacteria and debris. The endothelial cells are ones that are involved with angiogenesis, so that new blood vessel that's forming in that tissue is because the endothelial cells are active in doing that work. Platelets are helping to deposit growth factors in this phase. The epithelial cells are the new skin cells that are growing from the edges over that healthy red tissue. And if you look at this lower right photo, that pink edge right along the side of that healthy red granulation tissue, you can kind of see that thin pink edge. That's the new epithelial cells. You can easily identify that in this dark-skinned patient, that this new skin that's growing, that light pink color, those are those epithelial cells starting to migrate across that healthy red tissue. And then the mast cells help to support cellular proliferation. Again, they help to mediate this process. They're so important to this phase of wound healing. And then finally, we move into the remodeling phase, that kind of starting from the 2 to 3 week point, going all the way through to the 2-year point post-injury. So what's happening in the remodeling phase? Well, we get changes to the scar that are happening under the skin. So the skin finally finishes growing over that wound, and the scar starts to change underneath the skin. I oftentimes tell my patients when I'm doing education with them, it's like taking a bowl of cooked spaghetti that's all mishmashy and it's all jumbled together, and it slowly remodels over time like dense, like duct tape. So it's stronger and it's more solid, and it's less likely to be pulled apart as duct tape, as opposed to this mishmash bowl of spaghetti. So changes to the scar underneath the skin. The type 1 collagen is replaced by type 3 collagen. So you get collagen breakdown, collagen synthesis, you get collagen remodeling because the collagen fibers are reorganizing themselves again into more of that like duct tape type of consistency, so it's not easily pulled apart. But this takes up to 2 years to complete. And so you can imagine in a patient that has some sort of wound or ulceration, that area is at risk for re-injury. When the cells first come across and they close that wound, that tensile strength is not great. It's probably, I think, in the realm of 20–30%, if I remember from the literature. It's very, very weak in how those collagen fibers are organized to be able to maintain that tensile strength. And so it takes up to 2 years to maximize at 80%. And so that area needs to be protected and watched. And especially, let's just say somebody with a diabetic foot ulcer that's walking on it, how do we protect that newly closed area so that you don't re-injure and re-ulcerate? You get nerve fibers that start to grow into that tissue. So that granulation tissue we showed on the previous slide with lots of blood vessels in it, does not have lots of nerve endings in it. So it oftentimes doesn't hurt. Like if you had to debride or cut, you don't get a lot of pain oftentimes in that granulation tissue because there's not a lot of nerve fibers in that tissue itself. There might be a lot of nerve fibers around it, but usually not in that tissue until we hit this remodeling phase and those nerve fibers can grow in. The cells involved are similar as the cells involved in the proliferative phase, those fibroblasts, the myofibroblasts, the endothelial cells, the epithelial cells, but those cell numbers start to decrease as we move forward through that 2 years of remodeling. Okay, so we've just talked about the